joints. It is mostly stiff joints, joint stiffness. In Marfan syndrome, the joints are hyperextensible. In case of homocystinuria, the joints will be stiff. But in both cases, there will be arachnodactyly, that means long fingers. See, in this Marfan syndrome case, we will get to see that. So, when we are discussing, let us have a look on Marfan syndrome. Marfan syndrome has arachnodactyly, which is also common in homocystinuria. Ectopia lentis is also common in Marfan syndrome. Ectopia lentis is common in homocystinuria, but the direction of ectopia lentis is just reverse. Do you remember in which direction it is for Marfan and in which direction it is for homocystinuria? Do you remember?
Upward and inwards.
Yes.
Homocystinuria downwards and outwards.
Okay. Thank you for recalling. And there are some scoring systems, though these are not important for you, not too much important. Ectopia lentis, and in cardiac situation we get aortic dilatation or dissection. As it is an autosomal dominant disease, you may get a family history, and there are some diagnostic criteria, Ghent criteria, just get it to your mind. Apart from aortic dilatation, you could have, or child could have mitral valve prolapse. Sorry. And if you are asked about the facial features, child could have dolichocephalic head and downward slanting of the palpebral fissure, micrognathia, though it's not very common, retrognathia, sorry, not micrognathia, retrognathia. And so they see, when we are discussing about hypermobility and hypermobile, hyperextensible joints, at first we talked about Ehlers-Danlos syndrome, and then came the Marfan, and after these two we have to consider osteogenesis imperfecta. Now why I am getting back to it again? Because there are 4 varieties, and the commonest variety of osteogenesis imperfecta is type 1. It is the mildest one, okay? The commonest one is the mildest one. In this case, hearing loss is 50%, and most severe or fatal type is type 2, and mostly the child born in utero or immediately after birth. And type 3 is progressive deforming. It is a little late onset, and there is a type 4 variety that has also minimal features of phenotypical features. So that was it all about osteogenesis imperfecta. Mostly it's autosomal dominant, but there are autosomal recessive varieties, though it's rare. And in Ehlers-Danlos syndrome, you can see a Wheaton score. Okay, it's the score how to assess the hypermobility of any joints. There are different methods. Just go through it, because when you will be, it is not so much important for FOP and TESS, if not even so much important for AKP, but it is very important for the clinical part. So I told you that this is the folder you're going to need until you clear your MRCPCH. It's very, very, very important. Next comes Treacher-Collins syndrome. It's also very, very, very important. Give it 3-star. Goldenhar syndrome. This is also 3-star syndrome. Then Bohr syndrome, 1-star, not that much important. Pierre-Robin sequence I discussed to you last class. This is also 5-star or 4-star. Then comes Stickler syndrome. They love it a lot because it got Pierre-Robin sequence, and they have some midline facial deformities. They also got joint hypermobility. So we got another joint to join in our this section, hyperextensible or hypermobile joints. Number 1, Ehlers-Danlos. Number 2, Marfan. Number 3, osteogenesis imperfecta. Number 4, Stickler syndrome. This is a 5-star level important syndrome for this exam. They are loving this syndrome a lot. In lot of cases, you will find questions related to Stickler syndrome. And Waardenburg syndrome. What is the most important thing for Waardenburg syndrome? Heterochromia. Whenever they will be asking you indicating Waardenburg syndrome, it is an important thing. You may get a patient having features of vitiligo, that is skin depigmentation, white baby, a totally white out baby, hand white, hair white, everything is white, depigmentation everywhere. And the patient may have heterochromia. See here, one eye is brown colored iris and another eye it's blue colored. This is called heterochromia, and this child have recurrent chest infection. They may develop respiratory failure and cardiorespiratory failure sometimes, and Hirschsprung disease is the commonest GIT association for Waardenburg syndrome. It is a very rare syndrome, but fortunately I have also seen these patients in my life patient, not through any Google. And then come Apert syndrome. When Apert syndrome is being told here, I would like to ask you some craniosynostosis disease. Do you know what is craniosynostosis? Early or premature closure of the suture, cranial suture. That is called craniosynostosis. Premature closure of the sutures of our skull. This is called craniosynostosis. There are 4 important syndromes that you must know before you go to your exam, and one is Apert syndrome, then is Crouzon syndrome, then Carpenter and Pfeiffer syndrome. Okay, these 4 are very important. If it is possible for you, then Josen syndrome, you can also keep that in your mind, though I cannot remember it, or this is my inability to keep in mind, but mostly all the craniosynostosis syndromes are autosomal dominant except Carpenter, that is autosomal recessive. Okay, so which craniosynostosis have normal hand? That means mostly they are likely to have some syndactyly. Only in Crouzon syndrome there will be normal hands, that is no syndactyly. Which craniosynostosis have normal intelligence? Crouzon syndrome. Remember, they could have exophthalmos, that is the eyeball will be exposed more toward outwards from the cavity, from the optic cavity, from the eyeball cavity where it stays. So do you watch football? In football, have you come across about Mesut Ozil? We all know about Mesut Ozil, right? Former player from Germany. He have kind of symptoms or have some facial features resembling Crouzon. No, though not that much, but a little bit. Mostly he got big, beautiful eyes. Okay, I like him also. He got beautiful big eyes, and if you go through the Crouzon syndrome patients in Google, you will get to see the patients look very much similar to Mesut Ozil. So why I am mentioning Mesut Ozil's name? Because in all other, Mesut Ozil is a very fantastic player, a very nice midfielder he used to be when he was in his prime, and he had no digit related abnormalities or intelligence related abnormalities. He was very brilliant in the midfield, because a lot of brilliance is needed to control the midfield in football. Though those people who are football fans or who follow football or soccer, they know this very much, because midfield is the position what controls the entire game. So being a good midfielder, a classy midfielder, he needs to be very, very, very intelligent. So if he is a Crouzon patient, suppose, I am not saying he is Crouzon, but his face is a little like that. So if he is a Crouzon patient, he has normal intelligence. So among all the craniosynostosis syndrome, only Crouzon will have normal intelligence, and their hands and feet will be normal, so no syndactyly. Apart from them, all other will have syndactyly, and hypertelorism is also there. Hypertelorism, do you know what does that mean? Hypertelorism means a gap from the 2 eyes. The gap between 2 eyes will be very big, much bigger than it is normal. That is called hypertelorism. In Josen syndrome, there will be no hypertelorism, but in other cases, there will be hypertelorism. So Cornelia-de-Lange syndrome, another variety, a very, very, very important syndrome for RCPCH exam. Give it a 5-star mark. Also autosomal dominant. It has also got some cardiac common defects. Remember, whenever any syndrome which has got cardiac defects, you must put that in your important notes, because cardiac defects associated with syndromes are favorite part of RCPCH exam. So Cornelia-de-Lange syndrome is also their favorite. Just go through the features and through the face. They have also got some bony problem. Okay, see, they have ulnar dysplasia. Ulnar dysplasia is present in Cornelia-de-Lange syndrome. Do you remember ataxia telangiectasia? I think, did I discuss this? No, you have not attended the neurology class, just go through it. It has also immune deficiency, and ataxia is ataxia. They will have ataxic gait, nystagmus,